The endoscopic grading of the adenoid, you can see there are four lines. If adenoid is hypertrophied till the salpingopharyngeal fold, or you can say up to the posterior margin of the eustachian tube, then it is grade 1. If it is extend up to the white dash line, you can see up to the boomer, then it is grade 2. If this adenoid hypertrophy is extend on endoscopy up to the salpingopalatine fold, that is green line, or you can say anterior margin of eustachian tube, then it is grade 3. And if this adenoid is reaching up to the soft palate, you can see this yellow line, then it is grade 4. So this grading is equivalent to the dynamic MRI. So better endoscopic grading is better than the X-ray grading. X-ray is useless in adenoid because you can't assess the proper volume and size of the adenoid, and adenoidectomy mostly done in relative adenoid hypertrophy, not absolute adenoid hypertrophy. What is relative adenoid hypertrophy? It means the nasal obstruction because of adenoid, whatever the size is there. It means if absolute size of adenoid is quite enlarged, if patient doesn't have any symptoms, it means adenoidectomy is not required. If adenoid is relatively enlarged in the nasopharyngeal space and patient having history of nasal obstruction, failure to thrive, suspected malignancy, obstructive adenoids, chronic adenoiditis, chronic sinusitis, and adenoid hypertrophy leading to otitis media, then it is indicated to do adenoid surgery. It means adenoid surgery is mostly done in relative adenoid hypertrophy irrespective to the volume of the adenoid. So adenoid surgery depends on the adenoid hypertrophy plus clinical symptoms and nasal endoscopy, or you can say dynamic MRI. X-ray of adenoid is less reliable. It is not routinely faithful. So adenoid surgery should be done according to the history, endoscopy and dynamic MRI assessment. Thank you so much.